Okay, perfect. Also want to preface this meeting. If you hear craziness in the background, my toddler is at home with my husband, so just ignore the noises. So a little bit about me. Again, my name is Kayla Simmons. I live in Auburn, and have been married to my husband for almost 6 years. He is a Delta pilot and loves to fly, and I hate it. We have a sweet little golden retriever who is 5. Her name is Oakley. And we have a sassy 3-year-old who wants to be 16 named Graceland. And we are expecting another sassy girl at the beginning of next year. So we're excited about that. I graduated from Auburn with my master's degree in microbiology. I know that's totally different than what I'm doing. I got into this work just from some life experiences and absolutely love getting to do this. It's something that is really near and dear to my heart. And let's see. Oh, yeah, I was going to tell you, I love to garden. I'm that green thumb that loves to garden and antique. So if you ever have any questions about gardening or antiquing, I'm your girl. Okay, so today's agenda, we're going to talk about community power building organizations, how to partner with CPBOs, and then I'm going to go over like a real life example. I work a lot with faith-based organizations. And kind of what that goal can look like for you, and kind of how to work through some issues that may arise in working with CPBOs. So in the chat, just put your name, what your title is in the organization. I just love knowing who I'm talking to, and I'll look at that a little bit later. So community power building organizations and base building. These are two topics that I want to break down and kind of talk about. So has anyone heard of community power building organizations? I would love to just kind of know, has anyone heard of that? So we're going to go into community power building organizations. So the definition says that community power building organizations support base building, and that is often going to be around a certain location, a demographic, an identity, or an issue. Um, and the biggest thing that community power building organizations handle is they work to advance health equity. And that typically is around people who are most impacted by inequitable systems. Um, and looking at the definition of community power building organizations, I bolded base building because this is something, when I read this definition, I started studying about this. I'm like, what in the world? I don't know what any of this means. So today we're going to kind of break this apart so that you can get a really good understanding of what community power building organizations do and what their efforts are moving forward. So base building is organizations that create space to co-produce knowledge that builds and amplifies a critical consciousness that leads to mobilizing for change. So this sounds good. It sounds like, wow, power impacting. But again, I want to break this definition down just a little bit further. So critical consciousness. This is the ability to recognize that there are inequalities and also have the ability and desire to make change. So this is something that you're going to hear me say throughout this PowerPoint that I think is really important. Some organizations that we may work with or partner with may not have such a push for change or health equity. And what we want to see in partnering with community power building organizations is that they really do have an understanding of inequities and systems of power that people have struggles and also are given kind of the short end of the stick. And we want to be able to recognize those things, work together in partnership to really create that change and promote health equity. So if we put all these definitions together, community power building organizations are organizations that can really understand that there are certain communities who face oppressions and certain inequities and really want to do something about that by changing the circumstances and focusing their efforts on location, demographic, identity, or a certain issue. So you may be thinking, well, okay, community power building organization, this is great, but how do I know if I'm working with a community power building organization or not a community power building organization? So if it's not a community power building organization, sometimes those organizations are simply just going to accommodate the individual. They're going to basically make that person more comfortable, provide assistance through their circumstances, versus a community power building organization. They are going to work and fight to change the circumstances of people who are facing those hardships in their communities. So this is something that is really important because this is what we want to do. We want to work toward creating change. I work in rape prevention. And so the biggest thing that we want to see is we want to partner and work with people who are going to create that change. I think it's great to provide comfort and assistance, but the goal in the work that I do is I want to be able to partner with people who can really make a change. I mean, if we can make policy efforts and policy changes that stop sexual violence, then I've done my job, and that's fantastic. Um, I think it is really important to note that the community power building organizations, the forefront of their work is to promote health equity. And I know I keep saying health equity. I hope everyone knows what health equity is. If not, Faith, let me know in the chat if people are saying they do or don't know health equity, and I'm happy to take just a little moment to talk about that if I need to.
If you don't mind talking about that a little bit, I think that that would be great since I know we have a lot of our interns on to just kind of give a brief overview of that.
Yeah, so let me back up. So health equity is kind of been in the conversation from the CDC. And basically what it is we are trying to work to have everyone be their best self. And this has to do with the environment and the area that people work, live, grow, and play. Health equity is more than just like your physical health. It's also about your mental health. And when we talk about health equity, and I have a slides in a couple of slides, I'll talk about something called the social determinants of health. So I will go forward, and then once we get to the social determinants of health, I can really kind of hone in on how you can see how health equity plays out. So just to jump backwards, the core of base buildings, there's 4 things that when you're working with a community power building organization, you're often going to see these 4 things in that organization. And the first one that I think is super important is to invest in leadership within those marginalized communities. So the people who are facing the most hardships, those are the ones that are going to be put into leadership positions, or their voice can finally be heard in a way. And then oftentimes share a common identity shaped by similar experiences. You know, I mentioned earlier, I got my degree in microbiology and I ended up in this work. And that was because I had some life experiences that led me into this position, and I'm extremely thankful for it. And then understanding the root causes of certain inequities and oppressions. I think it's really important when we're working in sexual violence and sexual violence prevention or services that we understand that not everyone was given the same playing field, that everyone comes in at like a different point in their life. And so really understanding that there can be some root causes for how people get in positions that they are is something that's really important in working with community power building organizations. And then again, creating solutions to achieve change. That's going to be the biggest point in partnering with community power building organizations, is that we really want to see the ability for change to take place. So why work with community power building organizations? Again, change. We really want to promote and achieve health and racial equity. And again, the next slide, I will dive into how we kind of work through and understand health equity. And we want to work to transform those who have power and how that power operates. Again, that goes back to um, providing opportunities of leadership within those marginalized communities, and then identifying and improving some social, economic, and environmental determinants of health. So this is where I'll kind of hone in on health equity. So the CDC and Healthy People 2030 have kind of found 5 topics that are within the social determinants of health. These are all really important, and I think really can kind of like help us understand when we're talking about health equity, especially in sexual violence. These 5 topics can really kind of broaden an understanding and help us understand that people who experience or perpetrate sexual violence, that some of their lived experiences kind of put them at a higher risk. And so when we're talking about health equity in sexual violence and sexual violence prevention, it's really about making sure that every one of these points that we kind of like take into consideration when we're doing our work. And that may look a little different if for me, like I'm on sexual violence prevention, rape prevention. And so I do a lot of education and training and things like that, versus if you're on the advocate side or direct services, that may look a little bit different in kind of how you would approach the social determinants of health to kind of bring on health equity in sexual violence. I hope I'm not confusing or losing anybody. We are definitely working on, as far as ACAR is concerned, we are working on providing training to our rape crisis centers on health equity. That is something that we are looking forward to doing with you guys. But I think the social determinants of health is just it's a really big thing that just really helps us understand. So, for example, health equity is we want people to be their best self in every way. Social determinants of health are going to be the conditions where people live, work, learn, play, and grow. And so, if these are not all in a good place, then they may be at a higher risk for experiencing or perpetrating sexual violence. So, if education, we just talk about education access and quality. If you have low income families, typically they're going to be in areas that schools may not be very successful. Healthcare access, people who are again in low income, they may not be able to afford healthcare. As you can see, 1 in 10 Americans, they don't have health insurance. And if you don't have health insurance, I mean, even if you do have health insurance, sometimes you may choose to not go to the doctor just because you're going to get slapped with some crazy bill. And that's something that we have to think about. People who maybe have experienced sexual violence and they don't know that, medical costs, like a sane visit, is not, they don't have to pull out of their pocket to pay that. That's something that they wouldn't know. So they would be scared and not want to receive medical treatment or see a doctor strictly because they think they're going to get slapped with a bill. And then you have the neighborhood and built environment. If you have a area that is high in crime, they're going to be at a higher risk for experiencing sexual violence or perpetrating sexual violence. Social and community context. This is that social support. And, the people who are going to be most at risk here are going to be children, disabled persons. It's going to be people who are going to college for the first time. They lack that social support. They kind of don't have those close relationships that they can open up, express, receive guidance from. And then economic stability, people who are, again, in poverty, who have low income, those individuals are going to be at a higher risk. So I know that was like a lot I threw at you guys, but those are all really important when we're thinking about how to promote health equity, how to make someone be the best version of themselves so that we can reduce sexual violence. These affect everyone. Sexual violence doesn't happen in a vacuum. It can happen anywhere, anytime. And it affects everyone at all walks of life, but there are certain communities who are at a higher risk. And if you look at the social determinants of health, this kind of helps us hone in on those areas of people who may be at a higher risk. I hope that was clear. Before I move forward, Faith, let me know if there's any questions, but I want to make sure that we're not super confused moving forward.
I don't see any questions in the chat right now. Does everyone kind of feel on the same page?
I know that was a lot, so
No, it was
a
all
lot
super
going
important
on.
information.
Yeah. Okay, cool. So,
okay. Yeah, I'm not seeing anything, so I think you're good.
Awesome. Okay, so how to partner with community power building organizations. So, creating the foundation. There's 4 key pillars that are really important in creating that foundation. And one of the first one we're going to talk about is building that buy-in. So we really want to make sure that we are pursuing organizations that can champion the work as a whole. And what I mean by that is making sure that the community power building organizations that you are partnering with, or organizations, that they really understand the work. And what I mean by that is understanding that this is not just to, spread flowers and rainbows. This is about really getting your hands dirty, doing the work that needs to be done, and making sure that you guys are on the same page. And that kind of moves into get it in writing. It's really important that when you are making those partnerships, and establishing that base support between yourself and the community power building organization, that you get it in writing. And this may seem silly, but there's turnover in employees, and people that come in, they may have a different thought, but if you get it in writing, it just really creates just a neutral area where you can say, hey, let's go back to when we first started this. Let's see where we are, and it will just keep from issues arising. And then our third thing, identifying resources. As you all know, this work costs money. It'd be great if it was all free, but making sure that you can actually do the work. So you want to do the work, you have these ideas, but do you have funding or grants or donations that can ensure that the work is going to get done? That's something that's really important. And then lastly, staff the work for success. You don't want to put someone in the position of working with a community power building organization that has no clue what they're doing, who is maybe new to this work. So making sure that they're educated, that they have an understanding of the community that they're going to be serving, understanding how to communicate with the power building organizations, and then understanding that there are various cultures and people who experience these social inequities and systems of oppression, and just making sure that we kind of have that general understanding that we need to go in with, I almost want to say like a humble heart, because we all, like I said, we all go through different walks of life. And so going in and making sure that we are keeping that servant minded heart, and then that's what we're doing in this work. So now let's talk about ways to partner with your community power building organizations. The first one I love, because I have been able to do this, just jumping on the bandwagon of something that already exists, and creating a really great partnership. So if you have established opportunities, events, things like this, just having open dialogue and conversation, inviting those community power building organizations to participate is fantastic. And then the next one is to transform the way that government works. And what I mean by this is, you can go to your, oh Lord, my brain went, the Department of Health within your communities, and ask for research and data. Those of you that work with direct services, you have public testimony that can really help you in gaining that trust with your community power building organizations, because you kind of know the stories, you know what people are going through in your community. And then also get to know the platform of your elected officials, or even have a relationship with those officials, because those people were put into office by the people in your community. And so they may not even know. Like I have talked to mayors of towns and had other people, law enforcement, child protective services in the room in the conversation, and things came up, and the mayor was like, "Oh my gosh, I didn't know that this was even an issue." So, kind of getting in with your elected officials, because then it created a conversation of how can we fix this? What can we do? And that's really where we want to be. Is we want to create that change within the community so we can have a more healthy and successful community. And then sharing power. This again goes back to base building and co-creating those ideas and knowledges. It's really important that you kind of have that open relationship and open dialogue with the community power building organizations so that you can really co-create those projects. Again, you want to work together to create funding that can allow this work to take place. And then also formalize those collaborations. So don't leave them hanging in the air. Make sure that you get things in writing, like I said before, because that's just going to solidify that partnership and make sure that the ball gets rolling. And actions to support your community power building organizations. I think it's really important that we just remember that we're all human, and everyone has a life outside of work. And so check in and be personable. This again, I had one of my partnerships. As you know, we all live in Alabama. I hope everyone knows how the tornadoes work here. They just like show up and, rip things apart. And I had one of my partnerships, I saw on the news that their area had been hit. And so I just hopped on the phone and I was like, "Hey, are y'all good? Like, do y'all need anything? Did anybody's house get hit? Did y'all's building get hit?" And they were just like floored. Like, "You thought of me? Like, really?" And I think it's really important. And oftentimes we kind of forget because we get so busy and like drugged down into this work. Just to make sure you're checking in, be personable. Like, if you can remember they have a dog or children or something, the next time you see them, check in. Like, just make sure that you are understanding that they're also human, and make yourself known. Like, make sure that you are an available resource, that if they have any questions, there is a point of contact within your organization, within your agency, that these people can reach out. And again, leveraging those relationships with the government officials, making sure that they know who you are, and that there's an open conversation that can take place. Because when you get in with the people who are elected, who can actually really make a change, it's really important and it's vital in promoting health equity. So I talked about faith-based organizations. That is one of the sweet groups that I do a lot of work with. So we're going to look at an example. So what is a faith-based organization? That's just going to be a charitable organization or a nonprofit that's typically affiliated with a faith group or a set of beliefs. We live in the Bible Belt, so that's a lot of your Christian churches, but there's also your synagogues, mosques, faith-related nonprofits, some community development corporations, and then freestanding faith organizations. So what is your goal when you are reaching out to a community power building organization? So for myself, what is the goal? I'm working in faith-based organizations. For the rape crisis centers that we have that are a part of ACAR, your work plan is your focus. If you are not staffed at a rape crisis center, if you're a volunteer, if you're an intern, that is going to look a little bit different. And that goal is going to come from whoever you are working with within the rape crisis center, agency, organization, whatever that looks like. And so just making sure that there's an open conversation, a understanding of what your goal and what is expected of you, making sure that you don't get distracted. I am the world's worst at wanting to save the entire planet, universe, and everyone else in it. And I often have to get checked and be like, "Hey, is that on your work plan?" And I'm like, "Nope, It's definitely not. I'll move on. So just making sure that, you don't try to like be she woman or Superman or Superwoman, and that you're just meeting those goals and objectives, knowing kind of what you need to do. And then also what are the expectations of funders that you may have in your agency. So how to connect with faith-based organizations. So I think it's really important that when you're making those introductions to, and I'm saying faith-based organizations, but this can be the community power building organizations that you may be thinking about, make sure to introduce yourself and draft a dialogue of what you want to say. So what I mean by that is if you're going to pick up the phone, if you're going to write a letter, have a conversation with them, just kind of like literally create your skit in your head of this is what I want to talk about, this is what I'm going to say, and have pre-planned out answers for questions that you may think arise. This is really going to help because I can speak from experience in trying to make those connections with faith-based organizations. I'll tell them, hey, my name's Kayla, this is what I do. And then I get, well, why are you going to talk about rape? Like, why are we doing that in a church? And so understanding that there's going to be pushback, and go ahead and kind of like get yourself prepared and get yourself ready for what pushback may look like. That just really kind of allows for you to have a more fruitful and successful conversation. And then also be truthful. Tell them why you want to meet, what you want to talk about, and be flexible because some of these organizations, especially in FBOs, their work days are not our work days. And so making sure that you are able to be flexible and do this work is really important. And then one-to-one meetings, I'll talk about in the next slide. Cold calls, it sounds exactly like what it is. A cold call literally means you pick up the phone to someone you have never met before and you just go for it. It can be a little scary, but you have to do it sometimes. And then if you can't get in touch with individuals in organizations, send those letters with resources, information, who to contact. And also, if you do make good contact and good connection, make sure you learn the goals of the organization that you want to partner or work with. Because some organizations, you may see something and think, oh, they're going to be great to work with. Then when you learn their goals, they may be on a totally different side of thinking than where you want to go. So the one-to-ones, this is really a core part of building that really, really good strategy and relationship to advance health equity. And this is literally just you sit down with someone in that organization. Maybe you have a contact of someone that a community leader, and just really having an open dialogue. It's kind of an informal way of, hey, this is what I really would love to do. Can we be a part of partnering with your organization? And what would that look like moving forward? It doesn't have to be stressful or like super professional. I mean, obviously have some professional decorum about yourself, but it can be more relaxed and just having that open dialogue with someone in that community power building organization. Another thing that is super important is to know your audience. So when we're talking about faith-based organizations in particular, this one's really important. Now, if you are working with one faith-based organization, then you can be direct and specific. But I work with a group of faith-based organizations who are not all the same. And so I'm not going to call them a church or a congregation or a religious organization. I'm going to keep it very neutral in the sense of I'm going to call it a facility. Like, can I come to your facility? Can I speak to your community members? This is a faith-based organization, things like that, to just make sure that there's no one that can get offended because I use the wrong language. And if this is something where you're like, I have no idea what to do, please ask for help, because the last thing we want to do is have a conversation and it result in someone being offended. We want to make sure that all of our conversation is fruitful and that we can get this work done. And again, the same for images. Like I said, if you're working with one specific organization and you know what their faith belief is, then that is totally fine. But if you're working with faith-based organizations across the board, you want to be as inclusive and neutral as possible, and just make sure that you're not using any symbols or something that can offend someone. Things to remember. So this is not going to happen overnight. You're not just going to, I mean, sometimes they will, don't get me wrong. But it's important to move at the speed of trust, and that trust can take forever, and that is okay. You just don't want to, you want to, push a little, but not to where they are uncomfortable. The organization or the community leaders in that organization are uncomfortable. Attend and participate in events by the organization. Maybe they have not said they want to partner with you, but you found out on their website or something that they have an event going on or something like that, and you just want to show your face, be a part of it, let them know that you're serious about partnering with them. You want to gain their trust, earn their trust. That's something that is really important. And then don't promise things you can't deliver. I know this is sounds easy, but it can be kind of hard because you may think, oh, well, we can do that. And then you find out from your higher ups, actually, we can't. So just making sure that when you're going in, working with these community power building organizations, that if you don't know, don't promise it. Say, that's a great idea. Let me check with my higher ups and make sure that that's okay. And then lastly, I think this one is really important, is to make sure that those partnerships can last. So we want to institutionalize them and make them to where that partnership is not just that employee deep, making sure that it's like the entire organization, the entire agency has a good relationship with that community power building organization, because in the work that we do, there is turnover, unfortunately. And so we don't want to gain trust, gain access with a community power building organization and be like, yes, we finally have it. That employee leaves, and then you have to start all over again. I have this quote here by Dr. Martin Luther King Jr., and it says, power is the ability to achieve a purpose. Whether or not it is good or bad depends on the purpose. And so I want to charge everyone just with making sure that the purpose of your power is good, and that we are working to do this work, and we're working to do good things to kind of help those communities that we are servicing. I have 2 QR codes. Please feel free to scan these, or I'll send them to Faith so that she can make sure everyone has them. They're just some really good resources in talking about community power building organizations, kind of how to work with them, working toward that health equity goal, making sure that everyone has a good and healthy environment that they're growing and learning and living in. So I can send those out if I need to. I will open the floor for questions if anyone has any, or if anybody on the chat needs to just talk or say anything. The floor is y'all's. No questions?
I'm not seeing anything in the chat. I am shocked. Amanda, you sure you don't have any questions?
Can you believe it? No. She did a
Wow.
great job.
I know I threw a lot at y'all. I know that's a lot of information.
Yeah, I'm not seeing anything. I mean, if Amanda doesn't have any questions, then you must have really explained it well.
Yeah, that was
Covered it all.
breakdown.
Good. I either covered it all or I confused everyone.
No, it was really good. I understood everything you were explaining.
Awesome. And if y'all need any more resources, you can go like to the CDC, the social determinants of health. You can look that up. There's really great resources out there that can do a much better job of explaining way more in depth. They have some interactive stuff that I use to study all the time just to make sure I understand constantly. and different things like that. But again, I'm happy to send any resources to Faith if y'all want or would like to know more. And it doesn't have to be after this. Like if you're just like, I remember Kayla talking about something, just let Faith know. Or you can email me. That's my email. Please, reach out to me, call the office. They'll get you in touch with me. And yeah, that's what we're here for. I don't think we can hear you, Faith. Or I can't. Can y'all hear Faith?
I can't hear.
Okay. I was like, maybe it's my computer. I don't know. No, we're still not getting you. I don't know what changed. No. Uh-oh.
What about now?
Yes, there it is.
And I think my AirPods died in my ear. I think that's what
Okay.
changed.
Okay.
Well, thank you again. I had seen a version of this presentation done at the RPE meeting, and I thought that it would be a really cool one for us to have on. And we just really appreciate your time and all the efforts that you're, putting forth, especially with these communities. These are ones that, I think we've struggled to try to find, an in, just because, especially with having a name like rape counselors, like that's what we're starting off with, right? So it's kind of hard to find our spaces. So I think this gave us some tips and tools to hopefully work towards those spaces. And we have a lot of interns this semester too, so maybe that could be projects that they're working on. So
yeah, whenever I talk and I'm like, I'm with the Alabama Coalition Against Rape, they're like, why are we talking about rape? And it's like, if you would just let me explain, I promise, like, we just want y'all as a resource for the community. Like, that's literally it. We want to give you education, make sure, you get it, because there's a lot of misconceptions in the sexual violence world.
I don't know.
definitely, we definitely see that too. Well, thank you again. I'm gonna take a picture of her contact information too. So any of my interns, any of my people that need that, let me know. But if not, then thank you again, Kayla, and hopefully we will talk to you soon.
Okay, thank y'all.
Thank you. And thanks to all of our attendees.
We used to do
Yeah,
that.
thanks for y'all's
The other
time. I
day.
really appreciate it.
Perfect. All right. Bye.
Bye, guys.
Thanks.
I want you to make some of that buffalo chicken.